I'm Deborah Steenstra. Next slide. Okay. And I'll introduce myself more fully in a few minutes, but I wanted to go through a couple of housekeeping tasks to make sure everyone can access this event the way they need to. Please note that we are recording this event so that we can make it available to those who are not able to attend. We have a human captioner to provide live, accurate captions. We suggest that you do not turn on the captions in Zoom or click on Otter AI link. Instead, if you want to see captions, please click on the link that's provided in the chat to access CART live captions. And we'll post those several times in the chat. Because typing in the chat can interfere with screen readers, we ask that you not post into the chat yourselves until you're invited to. We will have time for question and answers in the last section of the event. And at that time, we're happy to have you post in the chat and also to use the raise hand feature to ask a question. If you have a technical issue, could you type a private chat to Jordan Craig using the drop-down list of names in the chat? Next slide, please. As I said, my name is Deborah Steenstra. I use she, her pronouns, and I'm honored to host today's conversation. I hold the Jaroslawski Chair in Families and Work, and I'm the director of the Live, Work, Well Research Center at the University of Guelph. I come to this conversation from years of advocacy and research, bridging international commitments on women's and disability rights with local experiences in Canada. And I was remembering this weekend with my children how each of them as infants went to the United Nations to lobby and caused a stir because I was breastfeeding them in the fora. So my advocacy is very personal and also political. I also lead an international partnership called Engendering, Disability, Inclusive Development, Genre, Handicap et Développement Inclusif. We call it EDID-GHDI, and you'll see the image for it on the screen, as well as the link. We work on rights and justice with and for women and girls with disabilities in Canada, South Africa, Vietnam, and Haiti, as well as transnationally. Please go to our website and check out our work. The chat is in, the link is in the chat. Next slide, please. I'd like to welcome each of you to this gathering from wherever you are around the world. And I know most of us, many of us are in Canada, but some are coming from other places in the world. I'm coming to you from what we now call Guelph in Canada. These are the treaty territories of the Mississaugas of the Credit First Nation. This territory is steeped in rich Indigenous history and is home to many First Nations, Inuit, and Métis people. We recognize the Indigenous peoples and their relationships with the land as an essential way to begin this conversation. I come as a settler and an immigrant scholar and want to make explicit my and the Live, Work, Well Research Center's commitment to learn from and with Indigenous people and to persistently insist on countering the effects of colonization, especially for Indigenous women, girls, and gender diverse folks. Next slide, please. This is the first in a series co-hosted and co-funded by the Live, Work, Well Research Center and Dr. Leah Levesque's Canada Research Chair in Critical Community Engagement and Public Policy. I'd like to acknowledge and thank Leah for her support and amazing work on this event and the series. Thank you, Leah. We're calling this series Countering Policy Exclusions. Each of the 3 events will reflect on themes emerging from our 2 intermingling research programs, EDID-GHDI's and Leah's Canada Research Chair in Critical community engagement and public policy. You got to come up with a snazzier acronym on that one, Leah. We want to foster dialogue and practice for intersectional solidarities and policymaking, with specific attention to the rights and experiences of women, girls, and gender diverse folks with disabilities. Given the ongoing and intertwined global crises related to climate, governance, and many other areas, we recognize that the status quo is not an option, and that there is an urgent need for conversations about new ways of understanding and responding to failures of the state. Centering the knowledge and experience of people most affected and often marginalized by these failures is critical for identifying and responding to them. But this knowledge and experience is often ignored in policy conversation across jurisdictions and policy areas. This series will center and help us understand the experiences of diverse women, girls, and gender diverse folks with disabilities from the national to local levels in their interactions with public policies. In today's conversation, we're focusing on commitments Canada has made in key international agreements, including on disability, women's equality, Indigenous rights, race, the environment, economic, social rights, and others. Reports from civil society organizations and researchers suggest that the implementation of these agreements is only partial, resulting in fewer supports and services for people with disabilities in Canada and abroad, and more people becoming disabled. For example, the Shadow Report on Canada's implementation of the Disability Rights Convention, submitted by the Native Women's Association of Canada, and the link is in the chat, argues Canada committed to ensuring that all people with disabilities have access to clean water, support for disability-related needs, and housing. Yet, for many Indigenous people with disabilities, a lack of safe housing, clean water, and disability supports in their communities requires them to make unthinkable choices about leaving communities to get services. This brings back reverberations of the residential school system, where Indigenous children were forcibly removed from their homes. The resulting long-term and intergenerational trauma means that Indigenous people with disabilities and their families cannot imagine sending their children or loved ones away from their communities to receive disability supports or education. As a result, these children, elders, and people with disabilities fail to receive what they need and what the state has promised they should have. As this example and other reports suggest, there are big gaps in Canada's implementation of its international commitments. Our panelists will discuss not only the gaps, but also illustrate how women, girls, and gender diverse people with disabilities provide leadership to counter these failures. As I said, this is a series, and in our next event, we'll be considering accessible housing in Ontario on Thursday, April 10th. And then in May, we'll be looking at accessibility in municipalities like Guelph. We hope you will join us for these events. But let me tell you a little more about how today's event will proceed. We're joined by 3 outstanding panelists. Their full bios are listed on the event website and are in the chat. Bonnie Brayton is the Chief Executive Officer of Disabled Women's Network of Canada, DAWN Canada. Stephanie Shapir is an assistant professor at the University of Calgary, and Lynn Gale is Algonquin and a member of the Piwanaquagan First Nation, an author, advocate, artist, and public speaker. We have 3 parts to our conversation. In the first part, I will ask each of our panelists to respond to the same question. In the second part, we'll have a question specifically tailored to each panelist. We'll post all the questions in the chat. In the third part, we invite you into the conversation in a question and answer session. We hope you can stay for the entire 90 minutes. With that as our background, maybe I can outline the first question and pose it to all our panelists. We'll start with Bonnie and then Stephanie and then Lynn. But the question is, in your area of work, what are a few key gaps in implementing Canada's commitment to international agreements? How do these gaps show up in the lives of women, girls, and gender diverse people with disabilities? What actions are needed to address these gaps? And how are women, girls, and gender diverse people with disabilities contributing? And each panelist will have about 5 minutes to respond. Bonnie, over to you.
Thank you, Deborah, and thank you again for hosting this important discussion. And of course, thank you to my fellow panelists for joining me in this discussion with you today. So fundamentally, it's in terms of these gaps, I'd say it's linked to decades of ignoring our population. You know, at a government level, I wouldn't say that we're not identified, but certainly a lot of Dawn Canada's research over the years has pointed to something that we see happens far too often, which is that women, girls, and gender diverse people with disabilities are footnoted in policies. In other words, the numbers acknowledged, the problems acknowledged, but the problem is never solved. It's simply noted. We did a series of reports and activities around more than a footnote, and in fact, an important report that's available on our website. I'll try to remember to drop it in the chat later. But I was going to say, in terms of where I think we start this conversation, Deborah, it's absolutely with the assumptions that were made over many years that we were somehow going to fit in, and that there didn't need to be any sort of way for people to make sure we were fit in. We were just going to somehow fit in. And that has left us, like I said, really for decades out of research and policy conversations. Again, right, the research was there. Certainly, you know, I know you've been doing research for decades, but as you and I know, it's only in recent years that you and I have seen some movement around even the conversation around policy, far less doing something about it. So one of the things I wanted to remind people of is, of course, the policy forum that Dawn Canada hosted in partnership with yourself and with Global Affairs Canada in 2022. And again, Global Affairs Canada themselves acknowledged in that policy forum that when they looked back over where they had funded and what their policy said, there was clear gaps between what they thought they were doing. And in fact, when they drilled down to where the money landed, it wasn't landing for women and girls with disabilities across the globe. And that's similar to what I've just described in a Canadian context. I'm trying to keep track of time. Where am I now? I'm sorry.
You're good, Bonnie. You've got another 4 minutes or so.
Okay, great. So what I'm going to quickly do is draw into something that I think is very relevant in terms of the context of the treaties, Deborah, which is, of course, the CRPD and the CEDAW, with an example that I wanted to share with everybody today around what works and doesn't work and really these processes. So Dawn Canada, as you know, Deborah was speaking with everybody about, has done shadow reports over many years and has been participants in UN CRPD and CEDAW events, including the upcoming Beijing +30. Dawn Canada was able to make it to Geneva for Canada's appearance before the CEDAW committee this past October. And so one of the things that I believe will be dropped in the chat for everyone to see is in fact Dawn Canada's report and what we went to CEDAW with. And I think that's important to see in terms of the work we did to prepare and the report in terms of itself, the whole experience. And again, the link also brings you to the blog of the two women with disabilities from Dawn who went, one of whom went for Dawn for CEDA, and the other one, Evelyn Hunchins, who's our Director of Indigenous Initiatives, also stayed on for some of the UNDRIP meetings. So I'm going to share the concluding observations from that because I do believe, like I said, it's a reflection of what we know is actually currently identified from Canada's last appearance before the CRPD committee. So in the concluding observations, which come out of, again, Canada's appearance before the committee, is some direct observations from the CEDAW committee, including on medical assistance in dying, and that they conduct a review of medical assistance in dying, track 2. Again, for anybody who doesn't understand the difference, there's 2 tracks. To analyze the links between gender-based violence, societal barriers, and systemic pressures faced by women, particularly women with intellectual disabilities, in relation to MAID. An indication of the overuse of MAID in the medical assistance in dying program and the absence of intersectional approaches in its implementation, which disproportionately affects women with intellectual disabilities and other disadvantaged groups. And again, I want to stress the fact that this is actually from an earlier report. It's not even reflecting the most recent numbers in terms of where we now know that is in Canada. And Dawn Canada and others, again, in terms of what do organizations like ours do in this situation, is we've actually gone to the Supreme Court to appeal the removal of Track 2 MAID. So again, the committee notes that women and girls with disabilities in particular, like I said, and this is really important, are ensure that women and girls with disabilities have adequate access to justice, inclusive education, employment, accessible housing, health services, including sexual and reproductive health services, and the state-of-art assistive technologies, increase the amount of the Canada Disability benefits so that women and girls with disabilities can get out of poverty. Again, these are the concluding observations. The committee recognizes the lack of impact measurements on legislation, the lack of effective involvement of NGOs, the need for more disaggregated data, the overall absence of policies aimed at gender, in terms of gender stereotypes. And so again, what I think is important to take away from the CEDAW report and from this in terms of, I think, really getting at that first question, Deborah, is that what we have seen and not seen in terms of, because I want to go back up to your question, because I've got to follow my notes here, is that where things begin to change in terms of that situation is with the growth and the increased capacity of an organization like Dawn Canada. For any of you who don't know, Dawn Canada is the only organization for women and girls with disabilities at the national, international level for Canada, and is actually coming up on 40 years in service. Our focus is research, education, policy, and advocacy. And that, again, is something that we're able to now work on in the last few years because of increased capacity. But that civil society capacity issue is the very large one that I think we need to point to in terms of going back to your question. So I have to scroll back up. What actions are needed to address these gaps, and how are women and girls contributing to this? Of course, my point being that civil society organizations like Dawn are, along with partners in academia such as Professor Steenstra and the Live Work Well Center, are beginning to get at these issues at a structural level. But really, when one considers that 30% of all women in Canada between 18 and 65 live with a disability, it's quite extraordinary to think we are still at a very early stage of seeing meaningful change in terms of good research beginning to come forward that is intersectional in nature, to understand that we're now at a point where that research is leading to opportunities like this around educating people and seeing changes in curriculum. And again, from a policy perspective, of course, a huge amount of focus on policy has begun to be realized through the work that Dawn Canada does, again, with partners like Live Work Well. And I think the most important thing to say is that in the last couple of years, a shift towards really understanding that what we really need is to see a lot more women with disabilities leadership on the ground across Canada. And that requires significant investments from the federal, provincial, territorial, and local governments, and of course, other local actors in civil society, Indigenous organizations, organizations for women, organizations for people with disabilities. And so, like I said, what I would say is that we are at a point now where the opportunity is in front of us, but it is about it being resourced properly as well. And that's, of course, the biggest gap is that this is an area that's been under-resourced and under-supported.
Wonderful. Thank you, Bonnie, for sharing those examples, but also the experiences. And isn't it amazing to know that you've had to go to the Supreme Court to fight for some of these rights?
Yes.
So thank you. Maybe I can turn now to Stephanie and ask the same question. In your area of work, what are one or two key gaps in implementing Canada's commitments to international agreements? How do these gaps show up in the lives of women, girls, and gender diverse people with disabilities? What actions are needed to address these gaps? And how are women, girls, and gender diverse people with disabilities contributing? Go ahead.
Thank you so much. I could answer this question in many different ways, but I think what I'm going to focus on is Article 19 in the CRPD, the Convention on the Rights of Persons with Disabilities, which is all about the right to live in the community and live independently. And I have, as is mentioned in my bio, I have personal experience with disability. I'm quadriplegic and I'm a professor at the law school and the School of Public Policy here at the University of Calgary. And I think my personal experience as someone who has pretty high needs with my disability, like I need caregivers every day. I can't get out of bed or get dressed on my own. So I have significant care needs, has given me a unique perspective on the difficulties of living in my own home and not living in an institution, and what it takes to do that. And so Canada has committed under the Convention of the Rights of Persons with Disabilities in Article 19, as I said, that people with disabilities have the right to live in the community. And this is based on a long history of disabled people being forcibly institutionalized. And I think one of the major problems we have in Canada that I think is quite is less discussed is the erasure of the existence of people who still live in institutions. And so what I mean by this is that when the Canadian government gathers census data, they use that data to then make decisions about programming, and they also use that data in their reports to the UN about how we're implementing the Convention on the Rights of Persons with Disabilities. But when the Canadian government collects census data, they actually only collect data on people who live in their own homes. They don't collect any sort of data on the demographics and circumstances of people who live in institutional settings. And that includes places like long-term care, group homes, any sort of institutional setting for people with disabilities, people who are aging into disability or have significant disabilities due to aging, and people who live in prisons, people who live in shelters, any sort of collective dwelling. And the reason that we don't know much about those populations is because when the Canadian government collects data with the census, there's two types of census. One is the short form, which is a very basic document. It goes out to all households. And then there's the long form. The long form collects more information. It collects this information so that the government can make decisions, of course, about like what our population needs. And so the long form census only goes out to people who live in private homes. And the short form census, in terms of gathering very basic information, if you live in an institutional setting, all the government collects about you is what kind of setting you live in and age and where you live, like province or territory. And the person who fills out your short form census to collect that information is the administration of the institution. So it's not even the individuals that live in these institutions that are filling it out. And so the long form census doesn't go to everyone. It goes to just a certain amount of the population so that they can have, you know, a statistically significant sample size, but they don't collect long form data on everyone. And so people who live in institutions, we only know very general things about them. But it's not only the Canadian government that uses this data, it's also academic researchers and policy researchers outside of universities that use this data about people with disabilities. And so when you look at what's called the Canadian Survey on Disability, it's highly skewed towards the needs and the circumstances of people who live in private homes, which I would argue are the most privileged of people with disabilities, that they have that financial or a financial ability to live in a home, or their disability is not very severe, and therefore they're able to live independently. And so the people that live in institutions, we just don't know much about them. We don't know why they're there, what kinds of disabilities, gender, anything about them really, other than the type of collective dwelling they live in, and the province and the age. So we see, if you look on the StatsCan website, you can see that there are children living in seniors' residences. And by that, I mean people under the age of 15. And one of the things you'll notice if you look at any sort of footnotes of when the Canadian Survey on Disability is used by either the government or by researchers, is that they'll put a footnote that says, the Canadian Survey on Disability does not include people who live in institutional settings or people who live on reserve or in prisons, etc. They don't say much about what that actually means, which is that the most disabled, the people with the highest needs who are forced to live in institutions for a variety of reasons, probably due to economic reasons of not being able to afford to live in a home with all the services one might need. But it's rarely discussed that if we don't collect information on them, then the survey on disability is very skewed to the most privileged. And I have seen in the Government of Canada's reports to the UN on the implementation of the CRPD that they mentioned that, it doesn't, the survey on disability and the data they collect doesn't include institutionalized people, but they kind of dismiss that population by saying, oh, it's a very small percentage, which, is actually something we don't really know, because if it's only the administration of institutional settings that's reporting to the government, there's a chance that we're not getting everything, because we're not hearing directly from people. We're hearing from the administration of collective dwellings, and there's no way to know that that's an accurate number. And so I think it's not really fair to say, oh, this is just such a small population, we don't need to worry about collecting data on them. But secondly, it's the people with the most severe disability and therefore in need of government services probably the most, given that so many people with disabilities who can't live in a home, it's due to their economic need. So I think this is a really huge oversight and something we all need to be aware of when we're looking at data that the Canadian government reports about the disability community. And I am out of time, so I'll continue answering or discussing this in my next question, but thanks everyone.
Wonderful. Thank you, Stephanie, for raising the issues related to the invisibility of people who live in institutions, in government reporting, but also in government data collection. A really important highlight on who's not part of the picture of people with disabilities when we report on our commitments. So thank you. And now I'd like to turn to Lynn Gale. Lynn, may I ask you the same question? In your area of work, what are one or two key gaps in implementing Canada's commitments to international agreements? How do these gaps show up in the lives of women, girls, and gender diverse people with disabilities? What actions are needed to address these gaps? And how are women, girls, and gender diverse people with disabilities contributing? It's all yours.
Kwe makanakdodam pekwakan and Dunjaba, Peterborough Megwandida, Gisigate Manado Kwe, Indigenous cause and Da Shagana she knows when Lynn Gale. Up to go and do Chanandam and Ishnabi Kwe Wayan. So first I'd like to say thank you to the Live Work Well Research Center for inviting me to speak today. Thank you to Deborah and Lenore and the other two panelists, Bonnie and Stephanie. I'm a member of Pikwakanagan First Nation that's located between Parliament Hill and Algonquin Park. I'm now a member after 30-year court challenge. Prior to that, I wasn't accepted as a member of my community. And my court challenges was about sex discrimination in the Indian Act regarding the matter of unknown and unstated paternity. I'm an Algonquin intellectual and advocate first. Just as feminists focus on women's political issues, as an Indigenous advocate, I focus on Indigenous people. And as a member of the Algonquin people, my focus is on the Algonquin. That's the Indigenous way. So the Algonquin of the Ottawa River Valley, our territory is 2,000 square kilometers, yet we don't have jurisdiction of the land or the resources. Our territory straddles the provinces of Ontario and Quebec. essentially through colonial genocide. The federal provincial order has been imposed on us. Today there's 9 federally recognized Algonquin reserves in Quebec, and there's 2 federally recognized Algonquin reserves in Ontario. In Quebec, there's 3 Algonquin communities that don't even have reserve land, and in Ontario, there's 3 historic communities that have not been recognized, nor do they have reserve land. Parliament Hill, the Supreme Court of Canada, the Governor General's residence, and the Prime Minister's residence all illegally squat on Algonquin land. So I'm going to begin today drawing from some work I did in the Gale report. Indigenous people on First Nation people living off the reserve, they have a higher disability rate of 30%, which is higher than the general population, which is 22%. And it's important to understand that Indigenous women with a disability are 2 times more likely than Indigenous women without a disability to be sexually assaulted, because we are easier targets. So that's really important. So today I want to talk about the United Nations Declaration on the Rights of Indigenous People, the United Nations Convention on the Elimination of All Forms of Discrimination Against Women, that's CEDAW, and the United Nations Convention on the Rights of Persons with Disabilities. Hopefully I'm going to address all the questions that is part of Deborah's 3-part question. So in terms of UNDRIP, the United Nations Declaration on the Rights of Indigenous People, Article 21 applies to Indigenous people with disability, that we have a right to live without discrimination, for example, and our needs must be met. That's Article 21 and Article 22 of UNDRIP. Article 26 talks specifically about land, our right to land, and our right to do what we want with our land. And Article 28 talks about redress and compensation. And so it's really important that we think about land and the resources that come from the land, and how Indigenous people have been denied their own land and resources, and thus build their own schools and build their own homes and build accessible homes, and have access to clean land, air, and water. So a lot of people know about the history of Canada's extinguishment of our land over time through the Robinson-Huron treaties and through the numbered treaties. The written texts talk about extinguishment, but that's not our understanding of it. But we don't have the power that Canada has and Ontario has. The historic treaty process ended in 1923 with the Williams Treaty in Ontario, and then it just flat out stopped. Canada refused to engage in any more treaties. But then after the Calder case in 1973, Trudeau, a senior, realized that they had to come up with some policy to address Indigenous land rights. And so they unilaterally drafted a land claim process in 1981. They unilaterally drafted that comprehensive land claim policy. And that policy called for Indigenous people to extinguish their land and everything, their land and rights and all their rights completely. And of course, Indigenous people weren't happy with that. It was known as the blanket extinguishment model. And then there was the 1973 Calder case where they realized that well, that's actually when they realized they had to draft a policy. And after the Constitution Act was repatriated, they again unilaterally drafted or amended the comprehensive land claim policy in 1987. And in that one, it said we had to extinguish our land and resources. So it was a really small shift. So the issue is that if Indigenous people don't have access to their land and resources, how can they care for the Indigenous people who have a higher rate of disability? And you don't have to go very far to understand and get beyond Trudeau's rhetoric of nation to nation and reconciliation. You just have to look at the Algonquin land claim process in Ontario, where they're only offering us 1.7% of our territory and a one-time buyout of $800 million. So what we need to understand is, contrary to Canada's land claim policy and the rhetoric of nation to nation and reconciliation, it remains Canada's policy regarding land and resources in terms of what they provide or allow Indigenous people to have jurisdiction of, remains race-based genocide. The policy shifts have come about without any consultation with Indigenous people. This is a violation of the UNDRIP. And Indigenous, again, Indigenous nations are unable to take care of Indigenous people with disabilities because they don't have the land and resources needed to provide housing, for example, accessible housing, good nutrition, things like that. Can I go on? Do I have enough time?
About 1 more minute.
I was going to move on and talk about CEDAW and that how, you know, Article 1 talks about sex discrimination. Article 9 talks about nationality, that Indigenous people have the right to be free of sex discrimination, and we have a right not to be excluded from our nationality. But unfortunately, that's not happened either. You can look at the Sex Discrimination in the Indian Act to further understand that.
Wonderful. Thank you, Lynn, for raising the issues of that tension between the commitments made in around Indigenous rights and yet the extinguishment of land through land claims process and the race-based genocide that you talked about. With that, we'd like to conclude the first section of our conversation and shift to more specific, more focused questions for each panelist. And we'll start again with Lynn. And so, Lynn, in thinking through those links between Indigenous people's rights and disability rights, you used what I think of as a wide-angle lens. That helps us understand some of the more structural links between colonization and the high rates of disability among Indigenous people. Can you talk about some of these links specifically in the context of resource extraction and development? How do you see that illustrating some of the tensions we're talking about today?
Yes, hopefully within the Q&A, I can get back to the to my other points, but yes, certainly. I'm just gonna do this one more off the cuff. So, Algonquin Park, the Algonquin Forestry Authority, for example, extracts $330 million from the park and adds that to the Ontario economy. And in terms of Ontario more broadly, the forestry industry contributes $18 billion to the economy. In terms of hydroelectric energy, really important. The Ottawa River exists within Algonquin territory in Quebec. It begins there and it ends there. And in 2005, it was reported that the Ottawa River generates $1 million per day, serving the Canadian economy. And just going more broadly to gold, in 2003, $6.5 million of gold were extracted out of Indigenous territory. So there's no reason why those resources can't be shared with Indigenous people with disabilities, and of course, more broadly with people with disabilities. And I want to just juxtapose that with something that I have some experience with Canada's court system and the Department of Justice. And the Department of Justice, their budget is $1 billion a year. It's really important for people who understand who want to take on charter challenges, for example, that the Department of Justice has a budget of $1 billion a year and a staff of 5,000. So we have this inability to compete with the Department of Justice when we want to fight for our rights. The other thing I want to point out is that right now the Algonquins in Ontario are in the process of a land claim. Canada calls it a modern treaty process. It is not. It's a land claim that forces us to extinguish our rights or define our rights completely. I'm not pro that process. I need to be really clear about that. There's no reason to hate people for thinking that I'm pro land claim. I'm not. And what I want to say about that is that we have to be careful with the media. So, for example, in 2016, Minister Carolyn Bennett celebrated the ratification of the agreement in principle for the Algonquin land claim process. It was in the media. It was celebrated. Yay, yay, yay. It was a great thing. And it's actually a really bad thing. We're not getting any of the resources whatsoever. So we can't move them into our territories, for example, and build better homes or cleaner homes or get access to clean water and clean sanitation. we really need to be careful what's going on in the media, and we need to be careful with the rhetoric of nation to nation and reconciliation. It's definitely a race-based genocide that continues. Again, 1.7% of our territory and a one-time buyout of $800 million is not sustainable for the Algonquin people. How's that for time? Can I keep going?
Yep.
So I'd actually like to go back to CDAW, Article 1, which says we have a right to be free from sex discrimination, and Article 19 that says we have a right to determine our own nationality. Unfortunately, the sex discrimination in the Indian Act continues to interfere with that process because they just refuse to address the issue of sex discrimination. The Indian Act was amended in 1985, creating new forms of sex discrimination. In 2011, Sharon MacIver, she took it to court, and the court really narrowed the remedies. In 2017, the same thing happened with the Desjardins case. And of course, with the Gale clauses in Gale versus Canada, Canada narrowly defines the remedies, thus not resolving all the sex discrimination in the Indian Act. For Sharon MacIver, a lot of people don't realize that in order for Indigenous women and all women to move forward to the United Nations level, we have to exhaust all domestic remedies in Canada. So that's why I point out that that the DOJ has $1 billion budget and 5,000 staffers. So after Sharon MacIver went through her process, it took her 10 years to move through the United Nations process. And she could only move to the United Nations once she was finished here in Canada. And that's the same situation with the Gale process. When I applied for Indian status registration in 1994, I was up against a really powerful Department of Justice, the biggest law firm in Canada. And they did terrible things to me, even though I was addressing issues of unknown and unstated paternity. They put all kinds of barriers in the way. I lost at the Superior Court level for really poor reasoning. And then at the Court of Appeal level, I won. And in 2017, that's when finally they addressed my court case, and I was able to be a member of the Algonquins of Pikwakanagan, because they wouldn't accept me. They don't have the resources to deal with more members that aren't status, for example. So currently there's Bill 38, which actually it's a dead bill now because of Parliament has prorogued. And it was there's a couple of things in that, well, they want to again address the issue of sex discrimination in the Indian Act that Canada just refuses to address. And so, for example, they want to, but then there's actually, Bill C-38 is a little bit narrow in addressing some of the issues. And the working group on sex discrimination, they actually want Canada to address things more broadly. They want Canada to address the second generation cutoff rule, the two-parent rule, and the elimination of the 1985 cutoff rule. And they want also a legal mechanism to allow women to return to their bands. And another thing that Canada has done is they refused us the right to ask for, what's the word? Reparations. They just flat out refused to allow us that. That's sex discrimination. Residential school survivors were allowed to have reparations, and so were day school survivors. But for some reason, the women who have been struggling with sex discrimination in the Indian Act were barred from asking for reparations. So again, Canada just continues to fails to address sex discrimination which intersects with race discrimination, which increases the likelihood of having an increased level of disabilities in Indigenous communities. And this issue, it intersects with the United Nations Declaration on the Rights of Indigenous People, in particular Article 8, and it also intersects with Article 2 of the Convention on the Prevention of Punishment on the Crime of Genocide. That essentially what Canada is doing is perpetuating its genocidal process through race-based genocide and sex-based genocide. Miigwech.
Wonderful. Thank you, Lynn, for bringing up the links between the land, the rhetoric around land claims, but also the real challenges of trying to claim rights at an international level. The time it takes, as well as the barriers that get put in the way. So thank you for those comments. Maybe I can turn then to Stephanie. And specifically, Stephanie, given that the federal government is responsible for international agreements like the Convention on the Rights of People with Disabilities, but many dimensions, including those you talked about earlier, require implementation by provincial governments. How does Canada's federal system affect its ability to implement international agreements? What do you think could be done to address this? And can you give us any specific examples?
Great, thanks. So I think that one thing we should, acknowledge at first is that the federalism can be used as a great excuse for government inaction, but it's not actually a real barrier to action. So let me explain what I mean by that. So the federal government is the one that binds Canada and signs international treaties. And so those treaties don't have automatic effect in Canada just because we've signed on to them. However, as Lynn mentioned, I think this is a really important point about how people, like everyday people in Canada, can try to enforce treaty obligations. And so Canada acceded to the UN Convention on the Rights of Persons with Disabilities in 2018. So that means that violations of the convention individual people can go to the Committee on the Rights of Persons with Disabilities to ask for it's not going to be like a decision that's enforceable in the same way as a court decision in Canada, but we can bring complaints on violations directly and get attention on the international level. But you have to exhaust all domestic channels first, just like Lynn said. So you'd have to go to make a human rights complaint, appeal it if you lose. And so there's very, very few cases that have gone to the Committee on the Rights of Persons with Disability from Canada. Last time I looked, it was 2. And so there could be more now, I'd have to check. But so that's the first thing to know, is that we don't really have a way to enforce these rights that we have internationally in a real concrete way. I think it's not really the same thing as our charter rights here in Canada, or our rights under provincial human rights code or federal human rights code. But we do know that we can put pressure on every level of government to keep up with our commitments, our international commitments, and human rights law in Canada. And sometimes, well, actually a lot of the time, the federal government will say, well, we can't do anything on this point. That's a provincial responsibility, or the provinces can say the same thing. But when you look at other priorities that the federal government has addressed at a national level, I think we can make really compelling arguments that if they wanted to take action, they could. So one specific example of this is action on climate change. So I look a lot at the law of the built environment. As a wheelchair user, it's really evident in my life the way building code isn't quite inclusive of disabled people, especially wheelchair users. And if you look at the projects and the level of financial investment at the federal level into climate-related building code, you can see that the federal government can do a lot more than they're claiming they can on the built environment, because technically building code is a provincial responsibility, but the federal government is investing significant amount of money in developing what's called retrofit code, because anytime we have new changes to the building code, it doesn't usually apply to existing buildings. But for the climate efforts at the federal level, they want to retrofit old buildings to make them sustainable for climate change. And yet, whenever you ask, why can't we retrofit buildings for the disabled communities across Canada, the argument is, oh, you can't retrofit buildings, like that's not what we do, and that's provincial. And so there's always excuses for the disability community that kind of seem to disappear when it's objectives that seem to apply to able-bodied people as well, which is the climate issue. And so when we look at how the federal government can invest in provinces and actually incentivize the adoption of climate-related changes to building code, then we know that they could be doing the same thing to improve accessibility by requiring provinces to make stronger commitments in their building code. And if you've spent any time in different cities across Canada as a disabled person, you know there are huge differences in the built environment between places like Quebec, which is the worst in Canada, I would say, and then places like Vancouver, which is probably one of the best in terms of accessibility, but not great in terms of affordability. So that's a different topic altogether. But I think we can see that the federal government can take leadership at a national level and invest their significant amount of resources, since the federal government has a lot more money than the provinces and is able to put terms on funding that it can provide to the provinces to implement certain national strategies. And I also want to mention the national housing strategy that the federal government has been implementing for the past several years to address the shortages of housing that we have across the country. The federal government isn't even requiring accessibility in the strategy. Yes, it's a stated objective, but the funds that the federal government is providing to provinces and to organizations that are building affordable housing are not held back on a requirement that those structures be built to be accessible. So it further creates a gap between able-bodied people and disabled people, because housing shortage is a huge issue for the disability community. And to tie it to my first point, it leads to a lot of institutionalization when you don't have housing that's accessible, especially for older people who we seem to think it's okay in Canada, which is not true globally, that it's okay to institutionalize older people with disabilities. But trust me, as someone who's lived 2 years in institutional settings, it's not a great place. You don't have control on your life. You don't shower when you want. It's not a place anyone wants to live, no matter the age. So I'll stop there. I'm out of time. Sorry, I went a bit over, but happy to discuss any of these things further in the question period time. Thanks.
Wonderfully. You were perfectly on time, so not the least bit over. Thank you for raising some of the tensions that federalism brings in, as well as its siloed thinking about building codes, housing strategies, and accessibility, as if people with disabilities didn't need housing, and as if climate-related actions don't have an impact on people with disabilities. So thank you very much for that, for introducing those things into the conversation. Bonnie, you have been active in a number of treaty body discussions. I know, because I've talked to you lots about those, including the United Nations Convention on the Rights of People with Disabilities, the CRPD, the Convention on the Elimination of All Forms of Discrimination Against Women, CEDAW, and the Covenant on Economic and Social Rights, CESAR. Are there any tensions between these different commitments and Canada's accountability for implementing them? How do these international commitments shape the federal government's obligation to ensure the experiences of women and girls with disabilities are considered in its policy development and implementation?
Well, I'm sure glad I got to go last on this one, because I wanted to say before I actually go directly to your question that from Lynn's response, that I wanted to add something or build off of what she said, which is, of course, to remind everyone else who's here that the high rates of disability in Indigenous women are strongly linked to gender-based violence, but to something that is important to understand about brain injury, which is traumatic brain injury comes from direct violence, but acquired brain injury comes from a long history of trauma and is just as serious in terms of how it impacts one. And so, to say the least, the Missing and Murdered Women's Inquiry completely failed to address this as one of the important factors that they needed to understand in terms of something systemic in nature, and where, another thing that that has and continues to drive these incredibly high rates of missing and murdered Indigenous women, and it continues to this day. And to Stephanie, it's like, oh my God, it's like you talked about silos, and it's like the first thing that I had written down around the whole question you've asked me, Deborah, is about the silos, because we hate the silos. And of course, there's a full-on irony to the silos, because it is the people who are most affected who are stuck with all these silos to go to. You know, the people who would be least inclined to have the resources to do shadow reports and go to Geneva and go to New York and fight the good fight at the international level are generally the ones struggling the most just to be at the table, as women with disabilities have often found themselves to be. And I do want to say that of those many treaties, that the one, and I will say this brings me all the way back to the beginning of my time at Dawn, to Bruce Porter, Leilani, and people telling me how important the Covenant on Economic, Social, and Cultural, because it's also cultural rights, is, because it is one of the only treaties, of course, that isn't the silo. It's sort of an everybody's treaty. And I do think it's important to recognize strategically that it is the one that most nations are most concerned with getting in trouble with, in terms of, if you will, at the level of being looked at either by the UN or, you know, by other state parties in that process. So CSER is for everyone is something that I wanted to say, just because if you're going to talk about them, that is the one that kind of is broader. These other treaties, of course, are incredibly important, and it's not because I don't think they are, but I do think it's important for people to understand that from a civil society perspective, it's a mountain. It's a mountain that we have to climb all the time, and it's a mountain we don't get a lot of resources to climb. But as a civil society organization that represents women with disabilities in Canada, even though we don't get well funded to do that kind of work, it's an incredibly important part of the work that we do. Are there tensions in the different commitments? Oh my goodness, yes, of course, right? Especially if you're an Indigenous or Black woman living with a disability. It's like, where do you put your energy and your time? How do you decide, you know, where to invest? Because in each one of these spaces is a whole community of feminist organizations or disability organizations or human rights organizations who are often very big and very presumptive in terms of the space they take up around the import of being, you know, and I'm not trying to be critical, but I give you the example of Amnesty International, right? This organization takes up a lot of the human rights oxygen in our country. So do Oxfam and some of these other groups that also get development funding and or get the government's attention because they have global reach. And, you know, again, to remind everybody, Dawn Canada is the oldest organization for women with disabilities in the world at nearly 40. And it's still rare. We still don't see that nearly enough. In a Canadian context, not at all. I was going to say, interestingly enough, I think through the UN systems, we've actually seen more women with disabilities organizations in developing countries where there's at least a notion that civil society representation means something. And in fact, in many of those cases, while they are present in the UN, their rights are not being honored in their home countries. In terms of the other thing I have in my notes is you have to work with the federal, provincial, territorial governments and civil society partners in a Canadian context, because I'm really glad Stephanie spoke about that, right? The whole issue of human rights, and for people to understand that in terms of the way decisions are made in this country, they do not appear to be shaped. The question you put, I think I wanted to focus on the way you put it. You said federal government's obligations to ensure, right? How do the international commitments shape their obligations? I don't think it shapes their decisions, that's for sure. In terms of how it shapes their obligations, I think it does, but if it did actually shape the way they made decisions, we would have a massive windfall, of course, because they would be looking at the data, right? And the data, again, just to remind everybody, is that 30% of women between 18 and 65 in this country are women with disabilities. I mean, that's a massive number, folks. This is the biggest unserved population in the country, and yet here we are looking at a blank spot where there's supposed to be policies, a blank spot where there's supposed to be resources, a blank spot where there's supposed to be us at the table. Hang on, I just want to scroll down. So rights holders are not seeing the change through these processes. I think the other thing that I think we really need to talk about, whether we're talking about the international treaties or the mechanisms we have in Canada, the rights of women with disabilities have not improved through any of these processes. I I think that's something we really have to talk about, right? In a Canadian and an international context. Are we doing the right thing by these processes? Are we serving the people we intend to defend through these processes? Do we need to change our way of thinking and start to look for the wins, the places where rights are working instead of where they're failing? Because naming those failures over and over again, I have to tell you from a civil society perspective, has made us weary and has made us jaded in terms of believing that these processes will have the impact that they should. You know, I've been to the UN, you come away from the UN, you're pumped up, you come back, and meanwhile back at the ranch, it hasn't changed. So I'm really glad we're having this conversation, Deborah, and that we're, you know, bringing at it from different perspectives, but also to really ask the bigger questions about whether these things are doing what they should, and if they aren't, how are we going to change that? Thank you.
Thank you, Bonnie. Thank you for reminding us that it's often a choice. Where are you going to put your time and energy when you get pulled in multi directions? And your concluding comments, is this where we want to be putting our time and energy in identifying gaps that we've identified many, many times before, or in working for the solutions and how best to do that? How do we deal with our colleagues in large human rights organizations who may not have got the message that women with disabilities are critical to understanding human rights more generally?
Well, I was going to say, Jordine dropped in the text, right? These are the concluding observations, right?
Absolutely.
And again, it's like, where are we with all of these things? The committee has said to Canada, it's like, you're not answering our questions. I mean, it was quite striking to be there, and our team was there telling us how the committee was just looking at Canada. It's like, you guys think you're real smart, eh? Showing up here, and it's like, you're not answering our questions, and we're going to have a lot more questions for you because you don't seem to be able to or want to answer the direct questions. So thank you. Sorry.
Well, thank you all, Bonnie, Stephanie, and Lynn, for such thoughtful and insightful comments. I think you've illustrated really important gaps and strategies to address sort of the silences, the invisibility of women and girls with disabilities. So unfortunately, we've come to the end of what I think has been a really dynamic. We have questions stacked up, ready to be asked, but we don't have enough time because we committed to being done by 2 p.m. Eastern time. So I'd like to thank you all first for coming and participating in what I think was an important and valuable discussion about the gaps in Canada's international agreements and the leadership of women, girls, and gender diverse people with disabilities in addressing these gaps. Thank you to our wonderful panelists, Bonnie, Lynn, Stephanie, for your insights and sharing your knowledge and experience and your enthusiasms and your passions. Thanks as well to those who've been working behind the scenes. You haven't seen many of them, but you may have received an email from them to make this event happen. Leah Levesque, my co-host and co-conspirator on many fronts, Lenore Lada, Jordan Craig, Benedicta Hughes, Carrie Shimon, Vanessa Bonham, Catherine Hall, and our captioner, Christy Purnell. We hope that you'll join us for our next event on April 10th. If you'd like to receive information directly about the Live Work Well Research Center news and events, please click on the link in the chat to join our membership, and you'll get all that information. So again, thank you so much for sharing your insights and knowledge with us, and I wish you all a warm and pleasant day coming up. Be well. Thank you.